Welcome to Integrated Spine Pain and Wellness Pain Perspective. I am Nikki and I'm here with my husband, Dr. Ashu Goyal. He is our regenerative medicine and chronic pain specialist. And today we are going to be talking to you about IV hydration and nutrition. This is an exciting new part of the practice that we're going to be offering to our patients. And so we want to take the time to educate you on exactly what it is and also the benefits of IV nutrition and hydration. So, Dr. Goyal, can you tell us a little bit about these two amazing services?
Absolutely. So we can start with IV hydration.
Okay,
right?
sounds good.
We all live in a desert.
Yes.
So here in Phoenix, Arizona. So most of us are dehydrated in a constant state of dehydration, which can affect multiple body processes and increase inflammatory response throughout the body. So IV hydration is one way to get fluid directly into your vascular system, into your cells, and really nourish the body.
Okay.
So this is an option for patients who may not be consuming enough water, people who work out regularly, they may be electrolyte deficient or just depleted intravascularly just from a dehydration standpoint.
Okay.
So that is one of the therapies we can offer now.
Okay.
It's just IV hydration.
Now, what's the difference between a patient just drinking, a liter of water versus actually coming in and getting hydrated through an IV?
That's a great question. So most people aren't drinking enough water or drinking the required amount of fluids to keep themselves adequately hydrated. So this is just one way to bypass that.
Oh, okay.
It's a lot more efficient. It does involve a minimally invasive needle prick. We are starting an IV when we do this. So it's for people who are looking more for a quick fix.
Okay. Yeah, just trying to, get that hydration. And are people able to use this for specific issues that, you've seen at other centers around the valley? People can do it for like detox, for, vitamins, for anti-aging. Is that something that you feel is beneficial?
Yeah, absolutely. So in addition to just the basic IV hydration with either a solution of what we call LR or normal saline, we can also add different micronutrients, specifically different vitamins, amino acids, anti-inflammatory mediators, things that can help us reduce inflammation and really nourish our cells to be functioning at an optimal level. So vitamins typically work as what we call coenzymes. So what they do is they help a bodily process function optimally.
Okay.
And most of us aren't getting enough vitamins in the diet that we eat. It's just that's a fact. It's been proven in several studies, dating back 20 plus years now. So one way to get your nutrients and an adequate supply of vitamins is to do it through an IV.
Okay.
So that's one of the benefits. A lot of people advertise these detox IVs. I think that's more just hydration, really.
Okay.
And then just replenishing vitamins that you may be depleted in.
Supporting your liver and allowing it to do the elimination process.
Sure. That would be like glutathione. That's one of our most powerful antioxidants that we can infuse through an IV.
Okay.
Yeah.
Wonderful. And how often do you recommend a patient do these IVs?
It depends on the person, really. I mean, it depends on their medical history, their kidney function, if they're diabetic, and their cardiac status. I mean, there's a lot of factors that go into that. But typically anywhere from once a month to 4 times a month, so weekly for some people, depending on what we're treating and what the goals are.
So one thing that's nice is when patients come to ISPW for their IV hydration and nutrition is you're able to customize the vitamins specifically for them, and you have all of their medical history. So it's safe, and that they're going to be getting all of the vitamins that they need to make their systems run optimally.
Absolutely. Yeah. So one thing that we like to promote at ISPW is individualized care. So, and that will cross over into the wellness aspect of our clinic and this IV hydration, IV nutrition. We're going to create custom IVs for each individual patient that chooses to receive that treatment.
Yeah.
So,
which is really nice. And what, like, how long does it usually take for somebody to come in and do these IV hydration?
anywhere from an hour to
Okay.
2 hours.
Okay.
So, it really just depends on their medical history, of course, their renal status, and what we're trying to treat and what the goals are. But a typical infusion would be over an hour.
Okay.
There are some supplements such as NAD. This is kind of a big buzzword in the
I know, I was gonna-
anti-aging
yeah,
world. Yeah,
okay.
so NAD plus is pretty much found in every cell throughout the body, and that's a topic for another day. But
Yeah.
it does, we believe, have some anti-aging properties, and so that infusion can be a little uncomfortable. So that's something
Okay.
that we do over a longer period of time, just for tolerability.
Okay. What's nice about it is that patients can actually come in, and we have a relaxation room at the clinic where we have recliners. Patients can kick back, put their feet up. We have a big TV that's in there. So while you're getting your IV, you can relax, watch a show, and before you know it, your hour is up.
That's right.
So it's really nice. Now, I'm just curious, what are some of your favorite vitamins and kind of combinations to use for health benefits?
I would say my two biggest ones
Yeah.
are glutathione.
Okay.
It's considered one of the most powerful antioxidants that we have available to us, and it's produced in our liver, and it can really promote overall health, reduce inflammation, improve the immune system function.
Okay.
So that's something I do weekly. And then NAD plus,
Okay.
which is the
Yeah.
anti-aging
Yes.
supplement. So I try to do that once a week, maybe once every 2 weeks. So those are the two big ones. Everything else is vitamin C, the B complexes, B12 included in that, different branch-chain amino acids,
Okay.
which are easily absorbed through the body, and then can also help stimulate muscle growth and create healthy muscle tissue. Those are the big ones. I mean, there's something called the Myers cocktail, which is very common. That just has a lot of your B vitamins and minerals. Also, we'll be offering minerals, zinc included in that, selenium.
Wonderful.
Yeah.
Yeah. It really is nice that you're going to be offering this to patients. And my question is there anybody who is not a candidate for these IVs?
It would depend on their medical history.
Okay.
So, ideally, we're going to be treating people who are relatively healthy.
Okay.
That's number one. For example, if someone has renal failure, their kidneys aren't working, IV hydration may not be the best thing for them.
Okay.
Because they have a fine line they have to balance between overhydration and underhydration.
Okay.
Because renal function. Same thing with patients who may have heart failure. So we don't want to fluid overload those people. Some vitamins and supplements can interfere with blood thinners and other medications too, but that's where the customization comes into play. So if anyone's interested in doing these types of treatments, we can review their entire chart and go over whether or not they're a candidate.
Wonderful. And what's really nice about the IV hydration and the nutrition, in the past with myself, I've used them just to boost immunity. And if you're feeling a little under the weather, it really helps me. It doesn't get rid of your cold or virus that you're dealing with, but I feel like it helps support you during the process
That's
to
exactly
recover. So that's also a nice aspect of the IVs.
Yeah, I agree.
Thank you for joining us for today's topic, and stay tuned for further topics with Dr. Goyle and myself. Thank you.
Thank you.